are the key differences between a psychologist and a psychiatrist, which might be good to distinguish?
Yeah. To answer that question, so a psychiatrist is a trained medical doctor. So all of us have to go through medical school training, and then after we've done all the basic medical and surgery rotations, after you get your medical degree, you then specialize into psychiatry. Psychology is they're not medical doctors. So they typically do a degree in undergrad, and then in Hong Kong you have to do a master's degree in psychology. Some of them do a PhD, and then afterwards they can become psychologists. There are different types of psychologists. For example, there are clinical psychologists, there are educational psychologists. So not all of them would see patients like me. But in terms of day-to-day practice, so clinical psychologists and us, we both see patients, but I'm allowed to prescribe medications, whereas psychologists cannot do so. And I supposedly should know what psychologists do, but because we have a large number of patients, I won't be able to have time to spend as much time as psychologists do on each individual patient. So these are the main differences: the way we're trained, whether or not you can prescribe medications, and also whether you have enough time to talk to each patient for a longer time compared to what I do.